Hi, it's Dr. Sherri here. I want to tell you a little bit about this test called the Holman omega-3 test, and this is about your ratio of omega-3 fatty acids to omega-6 fatty acids in the body. So have you ever wondered, if you should be taking fish oils, what kind of oils you need in your diet, how much fish you're eating on a day-to-day basis, is it enough? This sort of test will give you that individualized look and see exactly what you need as an individual. I really like this concept of test, don't guess, and that's where we can get a lot of results, is because we're actually looking at you as an individual, looking at your individual diet, and looking at how your cells are utilizing the food and the oils from the diet, and maybe the oils that you're taking from a supplement perspective. So this is an easy test to run. It just requires a blood finger prick, and it's pretty inexpensive. I'm really, really liking it in my practice. You can look here and see how much information it gives. So it looks at this total omega-3 fatty acids. It looks at your total omega-6 fatty acids. And then it does a nice breakdown of the omega-3s and the omega-6s, because within each omega-3 and omega-6 category, there are these breakdowns, and you can certainly be higher or lower in individual omega-3s or omega-6s, and that will play a big role in whether you are overall in a more inflamed state or whether you're in a decreased anti-inflammatory state. I think it's really important. It goes into even more detail and gives you this nice omega-3 HealthE score, which looks at you as a U.S. citizen and compares you to other places where we know there's less risk of inflammatory issues like cardiovascular disease. And you can look and see how you compare to the rest of the world and to your U.S. counterparts. I think that's a really interesting score. And then it also looks at these individual omegas and see where you are in comparison to the control. So we can actually, for the first time, really tailor what kind of fatty acids you need in the diet, which ones are going to benefit you the most. You can see that level of detail in this test and how many different fatty acids we can actually look at. It goes into quite a bit of detail here with the different essential fatty acids. So I'm really, really liking this test for its ease and low cost and its individualized approach. If anybody has cardiovascular issues, a family history of cardiovascular issues, if you are in any kind of inflamed state, so if you have aches and pains, joint problems, we use this term inflammation all the time, but we can certainly know what it's like to feel inflamed. And this can be a piece of that puzzle to help shift you from an inflammatory state. If people are having hormonal issues, particularly PMS, looking at that omega-6 fatty acids, there's certain ones in there that can be very helpful for hormonal issues, and making sure that you're in the optimal zone with all of those is wonderful. I really like this tailored approach and really being able to see what do we need on an individual basis, what kind of dosages do we need, what kind of fish oil do we need it. Everybody's body is going to utilize these oils differently. You can have, same people eating the same amount of fish, but some people are going to have lower total omega-3, EPA, and DHA than somebody else, even though they're eating the same amount of fish. So this is a great way to look a little bit deeper. Let us know if you have any questions, and have a healthy day.